Do you know that in most countries, suicide has taken more life than homicide? A 2006 report by World Health Organization (WHO) has stated that nearly 1 million people has taken their life a year. That amount is actually more than those who are murdered and martyred in a war. And it has also been said that suicide is the fourth leading factor of death among 15 to 29 years old. Quite disturbing, don't you think? I'm sure most of you are sensible that mental health conditions may be a major cause to the situation. But are you also aware that even the lack of awareness actually contributes to this sad reality? Assalamualaikum and a very good day I bid to the respected adjudicators and the dearest audiences of mine. My name is Afrina and I'm one of the representatives from Sekolah Menengah Sains student section Shahabudin, school code PEE 0051 for the public speaking event. To avoid more suicide cases from happening like the statistic I have mentioned earlier, I believe it has been my duty to spread more awareness about mental health conditions that include the topic I'll be taking you to dive in today, which is something under anxiety disorder called panic attack. First and foremost, we shall understand the definition of panic attack. What is panic attack? Panic attack is a brief episode of intense anxiety that causes physical sensations of fear. It usually lasts about 5 to 20 minutes, but some has reported to last up to an hour. Not only that, and if you're quite educated or familiar in the psychological field, you may have heard or know the term anxiety attack, and perhaps the similarity shares with panic attack. Well, do you also know the slight yet important differences between these two? For one, anxiety attack is actually a response to a perceived threat, while panic attack, on the other hand, happen rather unexpected and sudden. Panic attack has very intense yet brief symptoms compared to anxiety attack. And there is this one condition called panic disorder, where you have frequent panic attacks for a certain amount of time. Then, how can you know that you're having a panic attack? Well, you can do so by identifying these common symptoms such as hyperventilating, sweating, and also numbness and tingling sensations. You may also feel intense feelings of fear, derealization, feelings of unreality, and depersonalization, feelings of detached from yourself. Then, next, what are the causes of these sudden terror attacks? Well, a bummer it is, there are no clear reasons nor triggers to these panic attacks according to the experts. However, those with phobias may experience phobia-related triggers. For example, someone with acrophobia, fear of heights, may experience panic attack when they are on high locations. We also know some of the factors that increases the risk of having a panic attack. That includes family history, mental health conditions, and adverse childhood experiences ADE, or in other words, traumatic events that happen during one's childhood and adolescence. And now that we know the background of the panic attack in a nutshell, what are the treatments available to help the patients? First, we have psychotherapy, alias talk therapy. Cognitive behavioral therapy, CBT, is one of the common talk therapy that has been used to treat anxiety disorder patients like panic disorder throughout the time. The procedure is pretty simple. You just have to discuss your thoughts and emotions with a psychological professional like a psychiatrist. The results of these sessions may help to identify the possible triggers, and it can change the way you think, behave, and react to these possible triggers. We also have some medications like antidepressants to help make the attacks less frequent and less severe. Remember that small changes can make a big impact on the long run. You should also know how to manage your stress well as a step of prevention. You should also avoid alcohol, smoking, and caffeine, as these will make the attacks worse than it already was. To live with panic attack is to know how to manage the symptoms until the attack resolves. You can start by practicing deep breathing to encounter the previous symptoms I have mentioned earlier, hyperventilating. You can practicing mindfulness and also relax your muscles may help as well. For your information, acknowledging that you're having a panic attack actually help to help to manage the fear that you're feeling. Someone you know is having a panic attack. What can you do to help them? How can you help them? You can ask them what they need, stay, and also you remain calm with them. Because if you're panicked, they're more panicked than you. And keep in mind to always speak to them in short and simple sentences. You can also help by reassure them that they are safe and the attack is temporary. Keep in mind that these treatments, preventions, and also assistance are applicable to most mental health conditions. In conclusion, it's improbable to fully eliminate panic disorders and also other anxiety disorders. But it is totally possible to lessen the severe after effects. I hope that this Peace of Mind will be able to spread more awareness about mental health conditions and help to lessen the dilemma evolving around it. That's all from me for today. Thank you.